going to get us started and assume that there's also going to be other folks joining. And you might have noticed that we are going to record as well, because I think that this will become an increasingly hot topic as the next few weeks go on. And it's summertime, right? So we're really, really grateful to have so many folks here, but we know that there are other people on vacation who will be working on this when they get back to their offices. So I'm Shannon Rudisell, the Executive Director of ECFC, Early Childhood Funders Collaborative. I know we have some folks here who frequently are with us, and then also some folks who are maybe newer with us. And I want to give a shout out to our colleague Eric Stockton from Grantmakers and Help for helping us promote this and for being with us today, because I'm sure this is going to be something that they're working on as well. So thank you, Eric, for being here. So I am really glad that we are doing this, and I want to, there's many people that we could thank, but I want to give a special shout out to our member inside our family, Katie Beckman, who's been carrying the torch for this within ECFC, and who really encouraged us to talk about this topic and was really I don't know how we managed to time it so well. This has been in the news all week in terms of the approvals last week. So it could not be more timely. So we are joined today not only by Katie, but also by Dr. Lauren Smith, the Chief Health Equity and Strategy Officer from the CDC Foundation, who's doing fabulous work on this. Katie is from David and Lucille Packard Foundation, has been co-leading a funder-led vaccine effort. And we are also hoping that we know how things are with White House, that we will be joined by Dr. Cameron Webb, who is a senior policy advisor at the White House on the COVID-19 response team. And last but not least, our wonderful volunteer facilitator for today is Alexandra Quinn. She's the CEO of Health Leads, which is the lead organizing partner for the Vaccine Equity Cooperative. And I understand from the fabulous notes Rena gave me that she's also leading the Vaccine Kids Initiative that does not have a more formal name than that. They've been coordinating a group talking about how we create equitable access to vaccines for all kids, especially little kids. So Alex, I'm turning it over to you.
Thank you, Shannon. It's a pleasure to be here, and feel free to drop anything in the chat while we're talking, or if you have questions, and we'll take you through just some introductions to what the work we've been doing, both within this kids work, we're the Vaccine Kids Working Group. And yeah, there's not, we don't have a fancier name, but maybe Katie or Lauren will name it by the end of the call. And what I'll do is give you a little overview of what that is, and I'll then ask some questions and turn it over to the panelists. How's that sound? Good? Okay. So part of the work that we're doing at Health Leads is through this Vaccine Equity Cooperative, which I would think of it as a group that's working both hyper-locally with community health workers, CBOs, and others, and then working nationally as a coordinating support facilitation organization that originally was started around vaccine equity and really focused on how do we ensure equitable access to vaccines, but broadly thinking about health equity too. And as part of that group, former actually Health Leads employee and funder, Otis Raleigh from Rockefeller Foundation, and I were having a conversation about how do you coordinate funders across the sector around who's giving and supporting around COVID and vaccines. And his idea was, could we actually start a group, which started with around 12 philanthropies of what we call the Philanthropic Action Network. Lauren Smith actually helped design it and was like, let's actually set table stakes around racial health equity, and that anybody around the table should be thinking about that when they're thinking about vaccines and COVID. Katie later joined, and I'll tell you that story in a second. And we have been, for the past, I think, year and a half, although we're in a little bit of a hiatus now, really coordinating across both local organizations, some national nonprofits, and philanthropy to say, how do we make sure that the focus is on what investments needed locally for vaccines, and particularly for this group, kids vaccines. The quick story on how the kids vaccine group came along was Katie, I believe, was talking to Caroline Brunton from Kellogg. And I think quite a few of you had already started working on the child tax credit and had been quite successful in thinking through how do you have partnerships with government, philanthropy, and nonprofits to actually support the child tax credit getting out. And Katie, being both, I think, having good foresight and the warrior that she is, said, just saw a bunch of things coming down the pike that would actually get in the way of equitable kids vaccines. Caroline said, I'm part of this other group called the Philanthropic Action Network. Why don't you come and share that with them? And then she came, spoke to what we call the PAN, and then a few of us, Lauren, who else? Caroline, Monica from Kresge, who am I missing? Who also was part of that original group. Jan from Annie Casey, all came together and said, and then we brought in Mark Del Monte, who's the CEO of the American Academy of Pediatrics, Robert Boyd, who runs the School-Based Health Alliance, Dr. Rhea Boyd, who's an equity and child advocate, and then Bruce Leslie from First Focus. And we started getting together and meeting weekly and saying, how can we, similar to what you all did with the child tax credit, partner with government, partner with NGOs to focus on this upcoming 5 to 12 rollout of vaccines. And something that I saw both in my work with Health Leads and the Vaccine Equity Cooperative, and then at the time I was once a week working at the Vaccine Call Center for the San Francisco Department of Public Health with a community health worker hat, is that, and I think we all started to see, is you would have these great announcements like, guess what, with parental consent, anyone 5 to 12 can get the vaccine. But on the ground, parental consent looked 5 different ways to different clinics. So it might look like a parent coming with you. It might look like having to have a letter. It might look like having to have a phone call. And so on the ground that week, when the 5 to 12 was open to scheduling, it was absolute chaos, whether it be in a local clinic, an FQHC, or a big system. Even in San Francisco, where there actually was a really clear local ordinance on what should happen, it was really chaotic and inequitable. And I think that's what Katie and the other philanthropists thought around the table, like, how do we actually partner both on making sure that the government and everybody has what they need on the supply side, but making sure that we have the community resource and support locally to be able to ensure equitable vaccines. There's a report we put out. We've been working closely with the government since then, and now we're thinking about the 5 and under crowd. So we thought it was a good time to come talk to you and talk a little bit about how none of this is going to go away. Routine immunizations are going to be just as much of an issue. We know it's growing, and equitable access to even combating COVID as we think about school starting is still going to be a huge issue. So with that, Katie or Lauren, did I miss anything? No? Okay. So I'm going to pass it off to Lauren to tell you a little about her point of view and what they're doing.
So first of all, thank you so much, Shannon and Rena, for inviting me to be part of this conversation. I'm, as a pediatrician and former public health official for the state of Massachusetts, I'm thrilled that there are folks who want to have this conversation and so are invested, to do so. So that gives me great sort of joy and satisfaction. I guess I would just start, just quickly and say that the CDC Foundation has been part of responding to the pandemic from the very beginning. And one of the key strategies that we leaned into was working through and with community-based organizations. We early on made the determination that they are respected resources, that they can convey essential health information in their communities that can be done in a way that combats or overcomes, legacy of mistrust, distrust, or, skepticism, some of which is quite reasonable given people's experiences of their family and friends and themselves. And we know that they work at the local level in a way that's meaningful to people so that they have a way of connecting, or a mechanism of connecting that then can be linked to public health and other, health systems. So we early on made that choice. We do that through connecting with to help provide direct services and activities in communities. So we've funded through funds from federal funds as well as private and philanthropic funds, to over 250 community-based organizations across all the states in the US. We support them in developing partnerships with their local public health systems and infrastructure in places that they may not have had that before. And then we have, specific support around capacity building for them to be able to do that going forward. I guess I just wanted to point out a couple things. One is, throughout all of this, we have reached out and sponsored about a dozen webinars, and thanks to Health Leads, because they've helped produce many of them, that have reached over 17,000 folks. 2 were specifically focused on vaccine rollout for kids, including one that featured the Surgeon General, Vivek Murthy, and another that featured, subject matter expert from the CDC talking about vaccinations for young children. And there's also one that we specifically focused on misinformation and how that was going to have an impact or undermine our efforts to ensure uptake across all families of the vaccine as it became available for the youngest kids. The last example I would give is that just, I guess it's been now 2 weeks, we worked with CDC to have several dozen CBOs involved in a listening session for them to prepare for the rollout for kids under 5, especially for those who are serving communities of color. So we're, connecting the folks that are on the ground with the lived experience to be able to reflect on sort of, things that are happening. And I won't take up sort of too much time. I can give sort of other examples, but I guess I would say we are trying to work through the capacity building piece in terms of sustainable funding, how to support community-based organizations in their public health communication efforts, their partnership development with folks that they may not have developed partners with, while recognizing that they know how to do what's best in terms of connecting with their constituents, be it hosting vaccine things at child museums or youth museums or other sort of youth settings, or even connecting with schools and other partners. So we know that they know how to do that. Our job is to sort of help with the scaffolding around that and just help them with sustainable kind of funding for the staff and the infrastructure to be able to do that. So just a couple last things I would say, just another example, we've worked everywhere from Denver, where it had this Museum of Science and Nature that I was referring to that had a specific event that linked to other admission to other places that families go, the zoo and the botanical gardens, etc. Then we had a project in Chicago, which had a training session specifically for Asian American and Asian immigrant communities to be able to respond to specific concerns and issues that parents in that community there in Chicago had. So trying to be really focused and recognizing that it's not a one-size-fits-all, and we need to sort of ensure that people who have these deep connections with community have the information and the ability to share it and to combat some of the, the significant mis and disinformation that families are getting. So I'll pause there, but I'm sure Alice will be able to get more into it.
Lauren. So we have Dr. Cameron Webb with us now. Hi, Cameron. And would love, as I talked about a little at the beginning, and this is true for all the partners that we worked with, we've just been able to partner with government in, I think, pretty unique ways. And so would love, Cameron, for you just to talk a little bit about how you've been partnering with Philanthropy, what you see the next 6 to 10 months are going to be like, where can this group step in? How are you staying focused on kids and vaccines and equity and supporting local initiatives too?
Yeah, well, thanks so much, Alex, and thanks you all for coming together today. A few things. It's a big day and week in the pediatric vaccination effort because 18 million more kids just got the ability to be vaccinated, and that's no small deal. Actually, the reason I was late is I just did an an hour of interviews across, regions all over the country. And it was answering the same series of questions, which is, why do kids need to be vaccinated? How do we know these are safe? Why did it take so long? And really making sure that people understand why this is so important. What, the look on people's faces when I tell them that COVID-19 is in the top 4 causes of death for kids under the age of 1 over the last 2 years. It's in the top 5 causes of death for kids between ages of 1 and 4. When we talk about the fact that half the kids who were hospitalized with COVID-19 had no prior underlying medical conditions, right? I think what it does is it helps people understand what there is a real issue here. So certainly for the kids who do have underlying medical conditions, we've got to protect them in every way that we can. And a lot of those parents were eager to vaccinate their kids. We want to make sure that's widely available and accessible to them. But for a lot of other parents who think they've weathered the storm and the worst is over, want to be clear. They didn't have that same calculation with weathering the storm of measles, mumps, or rubella, weathering the storm of varicella or rotavirus. These are tools to keep our kids as safe as possible moving forward. And I know I'm preaching to the choir, but sometimes we need choir practice. And so what I'll just say is that this is one of those moments where we really do have to go back and make the case all over again. And so where the rubber meets the road here is that we're making that case again, far less resources than we've made it ever before. The adult vaccination effort, Congress knew how important it was, and we had $400 million for this public education campaign that, was a 2-year campaign effectively, at least if you say since, early 2021, we put a lot of dollars in through the American Rescue Plan. But that helped us get to the place that we are with over 220 million people vaccinated. We don't have the resources to continue to push that effort. And we've asked Congress for them time and time again, but we just don't have them. And so all of the conversations I just had in Charlotte and Chicago and in news outlets, media outlets all over the country, we can do that earned media piece. That's going to help. But we still do need to find other ways to make sure that parents and families and communities know that nobody is arguing that the COVID vaccine for kids under 5 is a panacea. What they're saying is it's a critical part of our overall paradigm of pushing back, of winning this fight against the virus. Winning the fight means keeping people as safe as possible, and that's important. And so there's a lot of communicating that we're going to need to do. And I know that the role that federal government's going to have in doing that communicating, we're going to do the best we can with the resources and tools that we have. But I think the voices and the role of philanthropy can really be to cast a broader net. There are a lot of folks, a lot of groups, a lot of entities that you are already funding and supporting in other ways. You're connected in community through a lot of community-based organizations, through a lot of folks who touch a wide number of lives all over this country. How can we harness that network and those collaborations to get good information out about pediatric vaccinations? Because if I continue to hear people say, right, but this is pretty much over, right? And the resounding answer is no. Resounding answer is you feel that way because of the tools and resources we've been able to get out, but doesn't mean that couldn't change in a moment. And it's so important for us to get more folks vaccinated. So I think the messaging piece is going to be really important. Certainly we're doing a lot of work. Treatments are only available for folks older than the age of 12. So that affects some kids, but widely that's really being used for adults. It's people at high risk for severe disease, but it has huge implications. Whenever you're talking about children in COVID-19, you're talking about the virus's physiologic impact on their body, but you're also talking about the wider social and mental health impact of this pandemic on these kids. And that, I think, has been one of the biggest and I would say often under-described issues that kids have been facing. They've been traumatized for 2 years. And so, when their parents are hospitalized or when their parent or guardian dies from COVID-19, that has huge impacts on those kids. So these are all really intimately connected. I think that, so we need to continue to make sure that parents and families know the resources and tools they should have. I know Alex has heard me say this before, but I've boiled it down to 4 things everybody needs to have on their checklist, right? They need to have high quality masks, and we want to make sure every family has high quality masks that are available to them. They need to have tests that are available for at-home COVID testing. That's going to be a really important part. They need to have up-to-date vaccination. And with the addition of the youngest kids being eligible to be vaccinated, now pretty much everybody in this country over the age of 6 months can do just that. And then finally, if people do have COVID and they're at high risk for severe disease, they need to know where and how they can get access to these treatments. We put those 4 things together, we can do a lot to keep communities safe, to keep kids safe, and to really do as much as we can to stamp out this pandemic. It's going to take some time, but we've got to keep working on it. I will just say a quick word. Yes, we're excited about these vaccines. The next generation of vaccines are already on the horizon, right? We're already trying to shuffle around the little bit of coins we've got left to make sure that we were able to get in line to get those next generation of vaccines when they become available. And it's probably going to be a late fall kind of thing in terms of when those come out. There's going to be a whole process there to review and assess and figure out where those fit in this paradigm. But just know that's something that we're working on now to make sure we're ready and we're prepared for. And then there's a broader dynamic. It's not going to happen today, tomorrow, in the next couple of weeks or months, but eventually, because of the way that this pandemic is and quite frankly isn't being resourced, there will be real conversations about the commercialization of the COVID response and how it becomes, a part of kind of our broader healthcare enterprise. And that has huge implications. So hopefully we can stay connected for those conversations in the months to come, because I'd love to put our heads together about how we can make sure that equity is still centered when you talk about commercializing the COVID response. It certainly is, it's a part of the natural course here, especially when Congress isn't necessarily going to act, but that doesn't mean that it's going to happen equitably just by its very nature. So we have to be really thoughtful about that. Still a lot of differences in COVID outcomes in different communities, despite the gains that we've made. But we're glad and proud of the progress. But the thing about equity work is that until you get there, the progress isn't good enough. We still have plenty to do. So happy to take any questions from you. And again, thanks for all that you all are doing.
Thank you, Cameron. And if anybody wants the 4 things he said, I'll drop them in the chat because I've written them down and sent them to everybody I know too. We'll come back to questions. I saw there was a question in the chat. I believe Katie will talk a little bit about this when she talks. And I wanted to hand it over to Caroline next, who, Caroline, would love to hear from your perspective. Kellogg has been deep in both the local vaccine equity and COVID response and nationally, and just your take on that and just public health would be great. So I'll hand it off to you next.
Great. Thanks, Alex. Hi, everyone. My name is Caroline Brunton. I'm a program officer leading the National Health Equity portfolio at the Kellogg Foundation. For those of you who may know some of my colleagues in the early childhood space, I sit alongside them on our national team. And so I lead that work, but also interact very deeply with our colleagues in our priority places of Michigan, New Mexico, Mississippi, and New Orleans, Louisiana. And so, I would say not dissimilarly to what Lauren raised about, we've been really focused, particularly in our priority places, of resourcing local groups, resourcing trusted messengers who can do that really on the ground, shoe leather outreach to folks about vaccinations. We've also, really been really responsive to the needs of the communities that we're working in terms of how we're partnering. For example, we've been really working with the New Mexico Department of Health around data partnerships and making sure that we have good data. If you think back to the early days of the pandemic, there was a lot of discussion about making sure that data was representative so that we knew what was going on, and that those efforts are still ongoing. And it's part of a larger piece with how the pandemic has really shown some of the cracks in our public health infrastructure. We've done a lot of partnering with tribal communities in the US, both in the Southwest and nationally. In a lot of ways, some of the tribal communities have really led the way in terms of effective strategies to ensure that their communities have some great vaccine uptake. And then we've also done some really specific work around research and messaging. For example, we worked with the University of New Mexico to do some oversampling of Hispanic and Latinx populations to really get at some of the issues within those communities in terms of vaccine uptake. Nationally, we've worked with groups such as the Vaccine Equity Cooperative that's been convened by Health Leads, to really ensure that we're connecting with not only our philanthropic partners, but the national thought leaders in the field, because one of the hallmarks of this pandemic has really been just a lot of information flowing, but has kind of been a dearth of places where it's been coordinated and, where people have the time and the space to connect on the issues. We've also supported some staffing through groups like ASTO and NACHO and other public health groups to make sure that as staff have left public health in kind of droves during the pandemic, that there are some folks that can jump in and plug holes so that the response is ongoing. I would also say that, we've been doing this responsive work kind of with an eye towards the longer public health infrastructure game. We knew, those of us working in public health knew coming into this pandemic that we weren't exactly optimally placed to have good response. And, I'm not sure that any of us really fully foresaw just how inequitable the response was going to roll out in a lot of different places and where some of the cracks were going to show up. So I'd say that all of our investments in this work, including the work with the Vaccine Equity Cooperative, we've had one foot in the response, but also kind of one eye looking forward in terms of like how we can take the things that we're learning on the ground and turn them into equitable, sustainable, community-centered efforts going forward and build a more equitable public health system going forward. So I think that's what I'll say.
Thank you, Caroline. All right, last but not least, I want to hand it off to Katie, the reason I think we're all here. So Katie, please.
Oh no, well, don't blame me. It is really a pleasure to be here with all of you today and a privilege to be on this panel with my esteemed colleagues. I'm Katie Beckman. I oversee the Children's Health Strategy at the Packard Foundation. I also direct our national and federal policy investments related to children and families across early learning, paid family leave, health, and family economic security. I guess I just wanted to bring a couple of points home. And I think you've heard the speakers talk a lot about what is needed in the field. Combating misinformation, utilizing trusted messengers that are in communities are essential. And there are a number of ways that you can do this. I think being able to leverage existing grantees in the field and being flexible with your funding so that they can meet the current needs of the day is really important. And that doesn't necessarily require additional funds. If you're thinking about additional funds, perhaps end of year funds that you need to get out the door, you may think about groups like childcare resource and referral networks, groups like the National Head Start Association. We really need to be supporting our early childhood providers, not only in taking care of themselves in terms of vaccinations and mental health, but we need to support them in being able to answer the questions that parents all over this country are asking right now. Cameron touched on some of them. Is this safe? Can I just wait for the next generation vaccine? Why, if this is harmless for kids like COVID, why do I even need to do this? And the reality is we know that these vaccines prevent serious health consequences for children, and they also prevent potential long-lasting impact of COVID, which, not to scare anyone, but we don't know what the long-term impact of getting COVID is on child development. We don't know that. So I wanted to also talk about a few other things that you can do. We have made investments with the American Academy of Pediatrics in terms of materials that are going out through their state AAP chapters. You can leverage those materials through your own networks. You can act and use your convening power and position of privilege to bring folks together in communities to talk with one another, folks in local and state government. I'll tell you, we've had the honor of bringing folks together at HHS and at the federal level, along with our colleagues at Kellogg, and have had some really important conversations about the importance of cross-agency work in supporting children and families. The other thing that I would say, and I want to address the question in the chat because I think that is incredibly important. And what you need to know is that during COVID, there was a plummet in well child visits in the United States. And what went along with that was missing millions and millions of doses of routine vaccinations. It will take years to catch up. And the misinformation from COVID vaccination has trickled over into routine vaccinations. In fact, I will tell you, someone just forwarded me some propaganda from the great state of Texas, where a gentleman was running on a freedom of vaccine platform. That's what we're getting ready for in the midterms. So, you know, I would say the answer is both and. I am hopeful that COVID vaccination will be approved to be part of the routine vaccination set that is recommended by ACIP and the CDC. You know, I think it needs to be framed as part of keeping our children healthy and safe. It is one piece of a complement of doing that. Kids need to go in for well child visits. They need to get their developmental and behavioral screenings. They need to get their vaccinations, and they need to get their COVID vaccine. And the other thing I would say is that ideally it's a whole child and family approach. You have a child under 5, oh, you haven't gotten your vaccine? Let's see what we can do about that. Because unfortunately, the pandemic isn't over. And as we get closer to the start of the school year, as RSV starts to increase, as who knows what variant of COVID is going to happen, we need to be prepared and we need to be ready. And that time is now to do that preparation.
Thank you, Katie. I'd love to kick it to Cameron next, just to talk a little about the same misinformation question, and then to Lauren, both in her role as a philanthropist, but also as a pediatrician. So Cameron, can you jump in?
Sure. So I think the misinformation part is really, there are a couple of different ways that we approach it. And again, we don't have the top cover communicating ability that we had earlier on, but I think that that's not necessarily what's going to win the day here. It's local trusted messengers that are always going to be the most important. And also people who can speak to folks within that local community context. Really, that's what's going to move folks the best. And so what we're doing is we're working closely with provider organizations, provider groups, making sure we can get good information to them, make sure they're ready to share that within their communities. But similarly, do the same through patient organizations, through other child serving organizations, and make sure that whether it's programs like WIC, programs like, you know, or entities like HUD, through our early childhood learning spaces, right, we're really getting good information out. There should be really no wrong door to giving parents and families good information about these vaccines, because you know, I'll tell you, and I think we were on a call, Alex, earlier a couple weeks back, and one thing that emerged and that we know is going to be the case is that even with these vaccines that just became available in the last few days, we know reactogenicity is a natural part of any vaccine. People have symptoms, fevers, there will be febrile seizures, there will be, you know, kids who are feeling lethargic or aren't wanting to eat. And that happens with every vaccine. The data from these COVID vaccines is that it's not any more common than other vaccines. Difference is that you're going to see a lot of kids getting vaccinated the next couple of days and weeks, and a lot of stories of reactogenicity on social media, and that's going to birth a whole new wave of mis and disinformation. And so we have to be prepared for that. We know that that's coming. We have to let folks know what's happening and how it fits into the broader context. That doesn't work best coming from President Biden in the White House. It doesn't work best coming from a top-down approach. It really works best coming from their pediatrician. The more we keep directing people back to their providers, the better. The more that we have local advocates and entities standing by ready to point people toward healthcare providers, toward the folks in their community and the public health community, that's going to be a key. But we really need to use all of our touch points to keep funneling and pointing people back toward these trusted local spaces. I think that's going to be so important. And then, I think that some of the incredible politicization of the pandemic that we've seen over the last few years, it certainly persists, but it's not what it was a year ago. It's not what it was a year and a half ago. We've seen, because of somewhat a tincture of time and because of just people's experience.
Uh-oh, do we lose Cameron? Was that only me?
No, it looks like we lost him.
Okay, he'll be back. That's well, I can text him too, but I'm sure he'll be back. So in the meantime, something that's been, and Lauren, I'd love for you to both, as a pediatrician, I'm going to add one more thing to your docket and then we'll open up for questions. But what's been really surprising to me is the powerful role philanthropists can play, because we don't have the social safety net or trusted messengers that we need in the United States. That means all of you are supporting nonprofits, especially local nonprofits, are playing that social safety net. It means that philanthropists actually are funding part of the social safety net and can have the conversations of, what do you need? How do we actually combat misinformation? How do we think about reinvesting into local organizations? And it means you're part of it in ways that may not have had before. Like, you're in the conversations, you're helping doing the planning, because it is an all hands on deck moment. And I think, Lauren, at CDCF, you all have done that brilliantly, right? Deployed all of the NGOs that you support and been part of the conversation and helping kind of barter both information and combat misinformation. So I'd love to hear about that. And then your view as a pediatrician too. And see, Cameron is back. Cameron, we have you back, but Lauren's going to go now and then we'll come back to you.
Okay. Just a couple things then, so we can jump back to Cameron. One thing I would say that philanthropy is well positioned to do is, it's already many in philanthropy who are, especially those who are in this early childhood space, are cognizant of the fact that healthy children require healthy families, which require healthy communities, and that there's a whole host of social and other kinds of factors that contribute to creating an environment that's conducive to kids growing up healthy and, with a full healthy across all the dimensions of their health, mental, physical, spiritual, etc. So I think that folks like you all who are in that early childhood space know that. I would sort of apply that in this case means that taking a holistic view to addressing people's other life priorities, because I think that for many families, although they're very interested in they may be very interested in getting their child vaccinated, but they have other pressing issues or competing priorities like housing or employment or childcare, like Katie was talking about. And as the economy that we're all watching gets worse and people are paying $5 a gallon for gas and more for food, that kind of those sort of budget trade-offs that parents have are going to be top of mind. So the idea of, like, if you want to have vaccine equity and get folks who have these other competing priorities to be able to be open and present and even listening, means you have to figure out a way to cut through some of that noise and address some of their other issues. And many of the places that we've been lucky enough to support have those conversations already ongoing. In fact, that may be how they know people, is because of the rental assistance they give or the advocacy they give with landlords or what have you. So being willing to open up your conception of what counts as an organization that can do health related work, I think would be really important. And then, in wearing my pediatrician hat, I cannot underscore enough Katie's points about the vulnerability of just regular basic childhood immunizations that are getting swept up in the whole a broadening, deepening expansion of an anti-vaccine movement. And we may decide we want to talk more about that today, but I just really need to underscore that, because what would I say, sort of the conscious, intentional effort to undermine the importance of just regular basic vaccines is happening, and that's real, and that means we will see the return of vaccine preventable illness, which is, kind of a travesty since we have such effective vaccines. And the last thing I would say is the only reason that I think this will even happen in a way is because the vaccines have been so effective generally that many people who are susceptible to this mis and disinformation have never seen natural disease. So they don't know what H-flu meningitis looks like, or varicella encephalitis, or any of the other things that we're trying to prevent. So it's like something that's way out there and like couldn't possibly happen. So it's because the vaccines have been so effective, we don't see natural disease, so people can be sort of sanguine about it because they haven't had to experience. So we've got to figure out how to get at that. So I'll pause.
Thank you, Lauren. Cameron, we wanted to hand it back to you if you're in a place to take it, if you wanted to finish up your thoughts too. And
Sure, it's not letting me turn my video on for some reason, but that's fine. I think the point I was ending on before my computer crapped out was just that, the politicization, the dynamic has changed. In some ways it's hardened in some places. In other ways you might have a new opportunity to go back in and engage. And I think that's not lost on us, that idea of kind of movable populations. We know that there's a dynamic there. Another thing to keep in mind on the mis and disinformation front, last point I'll make, is that all of our kind of survey data is telling us that people who had even some level of reactogenicity as adults early on, they're the ones who didn't want to go back for boosters. So there are a large percentage of the population who got primary series, didn't go back for boosters, but also if they're younger, who aren't getting their kids vaccinated, right? So that, I think there's a lot of education that we have to do for them as well. They say, if I was knocked on my butt for a couple of days after the vaccine or felt really, really poorly, I'm not going to do that to my kid. Well, the reactogenicity in kids is much lower. The dose is much slower, right? It's a 1/10 of the dose that it was in adults. It's been evaluated for its safety and its efficacy. It doesn't mean that nothing will happen in terms of a reaction, but it just means that your kids and you, it's a different dynamic. So I think we do have to re-engage, and I think that's going to take a lot of work. And that's why we can't view this as kind of a short sprint on vaccinating the youngest folks. We really have to view this as kind of building blocks toward getting people ready so that we can fight through the current environment.
thanks, Cameron. Lauren, do you want to jump back in?
Just to build on something that Cameron just said, which is so important. What pediatricians, family docs, other pediatric providers do at their best is, what we call anticipatory guidance. It is a key part of how we practice. So the piece that Cameron was just talking about is being really clear, specific, and reassuring about the kinds of reactions that kids are likely to get after vaccine, so that folks can put it into a context and have the parameters of when to worry and when not to worry. We do this all the time in pediatrics for a whole host of things. So this is squarely within the possible realm, but people have to be, clinicians have to be really prepared and ready to do that, have the time to be able to do that. It's great if there are additional resources that are developed at the local level, perhaps in partnership with the, adapted from the CDC or other sort of sources to, the local context of what resonates, what's the language, what's the verbiage that sort of, people respond to in different areas, so that they can refer to that. But that concept of managing expectations and helping people understand ahead of time what's going to happen, so they can have a way of putting meaning on it that's not a frightening, scary meaning, that they can understand it in a different way. That's really, part of what pediatric providers do. So I think it's possible, to Cameron's point, but does require a lot of energy and effort.
Thanks, Lauren. Such an important point. And if you think about, and Shannon, I see your hand, and we're going to open it up for other questions too, but just, it is an all hands on deck moment, and it is and very much been up to both, nonprofits and philanthropy in partnership with government to kind of create this seamless, enough resources to create this seamless experience for parents while combating misinformation, which is it's a tall order. Would love to hear thoughts, questions. Shannon, do you want to jump in first?
Well, I want to be sure that actually if any other participants want to raise their hands, that they should get in. But if nobody else wants to, I do have a question. I'm putting it on gallery so I can look. All right, in the absence of someone else, but someone else can jump in. A question I have is about language access. Because as I hear you guys talking about, it's been super helpful to hear, like, this is what we know is going to happen. And mostly that'll be from your pediatrician, right? Your Head Start provider isn't going to be able to look, nor should they, right, give that level of guidance. But there is sort of this baseline encouragement, reassurance that we want to see happen. And I'm just thinking about where I live, the sheer number of languages spoken by the families of young kids here, and wondering if there are resources that maybe state and local foundations should know about that are going to be provided nationally, so they don't feel like everybody's got to run out and like fund translation interpretation. And if they do, then we need to know that too.
Yeah, great question. Any number of the panelists could answer it. Who wants to jump in first on that? Cameron, do you, or otherwise? Yeah, go ahead.
I mean, what I can say is that I know that's been an interest in a focus. The resources that we put together from the federal side are on wecandothis.hhs.gov. So kind of going back to that space. But I think that, to be candid, I think the broader swath of language access has been a challenge throughout, especially with rapidly changing information. So I think that, one thing that we've aimed to do is certainly cover as much ground as we can with resources that some that are changing more frequently, but also just making sure we're getting out in Spanish and in Chinese. And so we've got a couple languages where we know we can keep that updated because we know there's a large percent of the population. For other states and communities where we know there are specific language needs, we just continue to look to engage as much as possible. And that's where additional resources and support can be really helpful. So it's definitely an area of deficit. I think in the after action report on how we've done with getting tools and resources to all communities, I just know that's been an ongoing challenge. But I think that it's one where we can certainly use some support beyond what's available on wecandothis.hhs.gov.
And just to build on what Cameron was saying, Shannon, I think there's something about translation, so having materials that are accessible in other languages, but there's something else about being a cultural broker or interpreting that goes far beyond having a piece of paper that, or a dot, or handout or what have you, or even PSAs or radio spots or, other ways of taking information. Because I would say, literacy in even your native language can vary a lot, especially with some new arrivals. But having that cultural broker, that cultural interpretation piece, I think is something that foundations and philanthropy can play a really important role in, because that's the kind of partnership development and sustainability that can work between local community-based organizations and their state and local health departments, because it's so unique. So the state and local health departments know, do they have a Hmong population? Do they have a Bhutanese population, or other languages of lesser diffusion that the CDC is not necessarily going to be able to make materials directly available in that language, but together the department, state and local health department, maybe it's also coming from a local health care system who through their community benefits program may want to sort of get involved in something like this. So I think there's lots of potential partners, but that really localized response where you all know who are the communities that are left out, who are communities isolated, especially new arrivals, et cetera, that would be important.
Thanks, Lauren. Caroline, did you want to add anything?
Yeah, I would say, just I want to double down on Lauren's point about state and local health departments. A lot of their websites are actually really good resources for language populations within particular jurisdictions. But I would also say there are a couple of community-based organization groups. I was just looking to find them, but I can't. There were some that were offering resources in upwards of 100 languages. So I think that there are some resources out there, but Lauren's point about the cultural brokers is really well taken, because static information is great, but if you need somebody to actually ask questions to, that's why resourcing the CBOs is so critical.
And go
And
ahead,
if I
Lauren.
could just quickly add, because the cultural brokers are going to say, well, guess what? The specific mis and disinformation that this community is getting is coming from home. So if you don't have access into knowing what people are getting from their home country, then you may not have crafted your response to particularly address an area of concern that is bubbling up in that community, which may be different than, another community. So, future reproductive issues may be really, a big deal in a certain community. But if you don't happen to know that, then your one's response may not take that into account. And so then you'll miss the opportunity to sort of have influence. And so the cultural broker piece can say, guess, this is where people are getting their information. This is, and can also identify some of those influencers, those local influencers, that if you get, like the elder mom, the elder grandmas, aunties in a certain community to be able to be, on board and answer their questions, then that could be like, the key to unlocking, a whole community's response.
The one thing I'd follow up, just not my moderator hat with that, is it is a person to person game, and that takes a different kind of philanthropy, right? That takes deeply trusting, whether it be local community health workers, local faith-based organization, local CBO, to be able to tell you the resources they need to have the 100 conversations to understand, convince, and then share data. Because what we've thought a lot about at Vaccine Equity Cooperative is then how do we take all the learning from the ground and share that playbook with others? And there are bright spots in places like, I think we won't have time to go into now, but Yuma, Arizona had, public health, local promotorists, local CBOs, local funder working together to combat misinformation and get vaccines out. But it is a different way of working between the CBOs, between philanthropists, and between public health and government. We don't have a ton of time. I think we probably have time for one more question, and then I think Katie's going to close us out, and maybe Shannon after that. But we want to make sure if there's anyone else that wanted to jump in with a super quick question. Okay. And if not, Katie, I'll hand it off to you to have last words, and then Shannon, I'll hand it back to you.
Yeah, I really don't have very much to say except to thank you so much for giving of your time. I know everyone's incredibly busy, but if you want to follow up after the webinar, feel free to get in touch with Shannon or me, and we'll try to help in any way we can. But thank you so much for your interest. And thank you so much to my dear colleagues who joined us today. It was a treat to see you and hear you speak.
Thanks, Katie. And Shannon, I'll hand it back to you.
So thank you, Alex, for facilitating, Katie for initiating, and everybody for showing up. So I'll say closing, what I'm taking away from this, and we have a lot of state and local funders who dialed in, so that's great, is that this is actually, we had national funders on the phone talking about the way you've resourced local CBOs, but we have a lot of state and local funders out there who really know those organizations directly. So I think that that's really, what I'm taking away is like that this is a local person to person, doctor to patient, trusted community health worker, kind of situation. So, you know, that's what really I'm leaving with, and thinking about how we can help our state and local partners, maybe learn about what happened in Yuma, or maybe know how to have access to some of the language access materials, and to take some of the concrete ideas that you guys shared. So thank you very much for that. And Rena, we will send out follow-up. You want to just say a word and then you can finish this out, Rena, about what folks can expect?
I can figure out how to unmute myself. I just wanted to share, we'll have resources on our event page, including many of the things we gathered in advance, some of the resources linked here, and we'll send some follow-up. There's also a Grant Makers in Health webinar coming up on routine pediatric vaccinations for their funding partners. If Eric is still on the line, I'm not sure if he shared that already, but we can include that in our follow-up as well. And we'll get all of these resources out to you in our follow-up link. And thank you so much to Alex and Katie and Caroline and Lauren and Cameron for jumping in on short notice to have this conversation. And we know we'll be talking more with all of you. Thanks so much. Have a great day.
Thank you.